Alright, here's my final practical video. We're gonna start off by doing the reflexes of the upper extremity. I'm just gonna demonstrate my fingers, so I have my reflex hammer. We're gonna start off with the C5 reflex. The arm. I'm gonna kind of press the patient's arm, just relax for me, so they can stay fully relaxed. I'm gonna tissue slack up on the bicep, right on the tendon, and then I'm gonna strike with my reflex hammer down on it. Normal finding would be 2 out of 4. I'll do that on both sides. 2 out of 4. Then we're going to do the C6 reflex. Just go ahead and relax your arm again. Now here, I'm going to have the patient radial deviate your hand for me, flex. I'm going to feel for the brachioradialis tendon, relax. I'm going to strike the tendon. Again, it'll be 2 out of 4 reflex. Do it on both sides, flex for me. Okay, relax. Then we're going on to the C7 reflex. Go ahead and put your hand on your hip. This is the triceps reflex. I'm going to tissue slack upward with my thumb. Then we go and strike the triceps tendon. Normal finding 2 out of 4. Let's do it on this side now. Traction up. Strike on the tendon. 2 out of 4. That was C7. Now we're going to do the T8 reflex. Go ahead and just hold your hand here. And for T8, I'm going to go ahead my finger underneath your hand. And wow, there's a T8. C8. I'm going to go ahead and strike upward on the fingers. Next one, I'm going to examine upper motor neuron involvement using inverted supinator assignment. So just sit normal, just relax your hand here. Now the patient's hand kind of pronated. I'm going to strike where the styloid process would be. And then if I saw their hand kind of flare out and twitch, it'd be indicative of upper motor neuron signs like such as ALS. Next one is going to be examining the shoulder for internal rotation restriction. It's going to demonstrate a supine adjustment, not the bunny hop. Just go ahead and lay down on your back facing up. So I have the patient's arm out here. I'm just going to go ahead and pull the patient's arm over, looking for internal rotation restriction. Do that on both sides. See if there's any differences. And then so there's more restriction on the right arm. So a corrective adjustment for that. I'm going to go ahead, I'm going to torque the patient's arm, reaching all the way around into internal rotation. I'm going to pull out with some distraction, and then it's just going to be, I'm going to overcorrect into internal rotation and force that arm into where the restriction is. The next one is evaluating the lunate for P to A restriction and setting up final pose. Just go ahead and set up for me. So I'm gonna find the lunate on the patient's hand. And this is gonna be a punch through semi-contact with my thumbs on the patient's lunate. My fingers are gonna be like this on the back, so I'm gonna punch the lunate through my fingers. And I'm gonna have the patient lean away. As they lean away, it's gonna distract, and then I can do a P to A adjustment on the lunate. Next one is evaluate TL junction for extension restriction and show an adjustment for this problem with patient seated. So go ahead and put your hands on your shoulders, elbows up, as much as you can. I'm going to hold the patient's arms here, and with a pincer contact, I'm going to evaluate the TL junction, so I lean forward. I'm going to be pushing P to A on the spinous processes, looking for restrictions. Now adjustment for this, I'm going to be sitting at the end of the table facing this way. Cross your hands, hug yourself like you love yourself. Now I'm going to contact under the extended restriction there. With my finger, I'm going to take a deep breath in, all the way out. I'm going to lean the patient back. And I'm going to thrust A to P. And adjusting the TL junction with the extension restriction. Now I'm going to evaluate for internal rotation restriction of the hip, demonstrate my final pose for long axis tug of war position. So go ahead and lay again, face up. Now the patient's leg off the table here, and a knee bent. I'm going to go ahead and I'm just going to torque and feel for internal rotation, external rotation. Look for restrictions, do that on both legs. the restriction here, the adjustment would be take the patient's leg up in a tug of war position, my hands around his lower leg. I'm going to internally rotate the leg, lean away with a neutral core, and adjust with a long axis adjustment. Next, I'm going to evaluate A to P, P to A glide with the fibular head and demonstrate my final pose for P to A restriction on an osteoarthritic patient. So if you could just slide it up, Nick, for me. Now the patient's knee flex on the table. I'm going to take an M to L tissue slack on the fibular head here, so I can hook onto that with my index finger. And I can go ahead and pull P to A, feel it for the springiness, and then I can do the same thing with my thumb on the fibular head, pushing A to P. And then all my adjustment there is just going to be a thrust either P to A pulling towards me or A to P pushing. And then number 9, we're going to evaluate internal external rotation, flexion, extension restrictions of the first MCP joint. So you face this way. So for the MCP joint, I'm going to hold the patient right here on his thumb on the first knuckle. So then I'm going to take that joint and I'm just going to stress it to internal rotation, external rotation with twisting motion, bring it down into flexion and extension. Ask if there's any pain with that, look for the restrictions. Internal rotate, external rotate, flexion, extension. And then an adjustment for that is going to be a distraction. The corkscrew method, I'm going to pull out, twist internally rotate, pull out, externally rotate, pull out, flex, pull out, extend. And then those are also the dorsal plantar, plantar dorsals, the flexion and extension restrictions, and that's going to be the mobilization for that. And the last one, we're going to evaluate muscle strength for L4, L5, and S1 nerve roots without touching the patient. So Nick, can I have you stand up? You're starting the dumbbell rack there. Facing me. Go ahead and just walk on your heels slowly towards me. Here I'm going to be looking for a toe drop, foot drop for the L4. Okay, good. Now starting here, facing that way. Then you walk on your toes. Here I'm going to be looking for L5. S1 with the heel drop. Alright, and then stop, face me again. You'll be on your heels now with emphasis on the outside of your foot. And walk towards me slowly. And here I'm looking for more of a toe drop than a foot drop. And he's all normal there. And there's my move.